Hello, and welcome to a new edition of Education the Best Medicine. And thanks for watching. And remember, community public access is your best bet. I want to say a special thank you to the Facebook community and the hopefully the intersection with Dr. Lenore's community as a pediatricologist, and also I'm co-hosting a show with him, and we're going to start doing podcasts, and so I'm really excited about that. And it's thank you to you and all the things that you have allowed me to do, and appreciate that. I want to say that in trying to be in the spirit of this intersection, we're going to start covering some topics that you'll probably be seeing again in the general media and on the podcast, and including some exposures to some major networks. And as that happens, we will bring it to you. Just wanted to kind of start with some highlights of the year and have a discussion and to ensure that we are, doing what we need to do. With that being said, one of the areas we wanted to focus on was vaccinations. And January is mental health wellness month. And so I want to talk a little bit about that and just a different take on mental health, not just the illness, but how we can stay mentally stable and well, given all the things, sickness, health challenges, family members, trauma. So it encompasses a major discussion I continue to have is to ensure that we have all the voices and all the people that we can't have on that. And I want to say a special thank you to Patricia Lowe and Ms. Collins and all the folks that are viewing us live, and appreciate that. Want to also thank Atomology, the protagonist, the leader, the technical whiz, and for the venue, and also, of course, that has Aja's Conscious Soul and Miss Barbara Harwood and her continued work in the field, and we hope to continue to be able to provide these kind of programs to you. And so, and I guess with that, the first topic that came up was this discussion on alcohol and cancer. And so peruse the some of the information, and in particularly Dr. Vivek Murthy, who is the Surgeon General who authored this particular paper. And so I think one of the things in 2025 is, again, I said we need to always provide information that is evidence-based and honest and as free as it can be of bias. Again, I want to thank Terry West. I appreciate you for watching. I'm trying to do that more to really thank folks for viewing and supporting you. Support Believe Radio, 24-hour inspirational gospel music channel run by a man of color. And we think the messages that we've been allowed to provide are so important. And so what came up with one of the discussions is a discussion on alcohol and cancer. Well, alcohol is famed for making people act a fool. So, what else could we say about it? Now I have nothing against alcohol. I drank a number of years ago, but I think that we have to kind of take a real revisit to what the effects of constant alcohol use in particular communities and what that effect has been, and why we tend to get sicker quicker and stay sicker. Common issues like alcohol and tobacco use and abuse are some of the foundations, a lot of the medical problems that we have. So I asked with that context. So it said that this directly out of the report said that The Surgeon General has a direct link between alcohol consumption and increased cancer risk. Alcohol consumption is the third leading preventable cause of cancer in the United States after tobacco and obesity. So let that slip in for a while, because it's a third leading cause of preventable cancer, preventable heart disease, preventable, accidents, and so I think that's how we have to start viewing this in the lens of, no one's against, so celebration type alcohol use, but the discussion has to be, is your body able to tolerate that substance and it not have not only a toxic effect on you, but also a weight gaining effect? So many folks say they just reduce their alcohol use, they would lose weight. And if that's the whole issue, you can't have it all. You can't have the pill that makes you lose weight and then take a substance that starts having you gain weight and wonder why you can't make any kind of progression. So it says alcohol is a well-established and preventable cause of cancer, responsible for about 100,000 cases of cancer and 20,000 cancer deaths annually in the United States. Yet the majority of Americans are unaware of the risk where we are now. And know the cancer, I knew the heart disease risk, but not really the cancer risk. So the Surgeon General, Dr. Vivek Murthy, says the advisory lays out steps that we can take to increase the awareness of alcohol cancer risk and to minimize the harm, right? That's what we want to do. We want to minimize harm in 2025 and forever. The direct link between alcohol consumption and cancer is well established. But when's the last time you had your provider talk to you about the use of alcohol and its deleterious effects? Because most folks are drinking. So we have to kind of separate the noise and separate the signs, understand that, this activity can cause long-term health consequences. And so that's the prism which I want to view this problem. It says direct link between alcohol consumption and cancer is well established for several types of cancers, including, makes sense, right? Breast cancer, colorectal cancer, esophageal cancer, cancers of the throat, of the tongue and the throat. The liver, of course, mouth, so oral cavity cancers, throat, again, pharynx. Again, this is the mouth, this is the throat, this is, that area that is more an issue with oral cancers. That's why you have to have a dental exam. That's why you need to be seen regularly. And it's really, really important that you take these things to heart, because again, we need to be an informed community. And so if you're informed of the risk and you still choose to do that, when something happens, you have to be okay with that and what can be done given the fact that this could have been a preventable cause of the problem, And we're not even going to talk about mental health challenges in alcohol. That's a whole different issue. This is why January is mental health awareness. So I think that the two coincide. We just have more evidence that alcohol changes the way you think, the way you act. It increases your risk. You're more likely to die in an accident or be a causer of an accident. Right. So that's kind of interesting. Says cancer risks increase as alcohol consumption increases. And I would say the caveat to that is that if your body doesn't handle alcohol as a toxin well, this makes it even more issue because you could drinking little amounts and having major effects because your tissues can't handle it. And so that's the genetic connection of alcohol use and how we have to think about how this does affect us. Again, it's important. So for certain cancers like breast, mouth, and throat cancers, evidence shows the risk of developing cancer may start to increase around one or few drinks a day. So here's the conundrum. We've been told that 1 or 2 drinks would be okay, but it's saying now that even the 1 or 2 drinks may be an issue in terms of increasing your risk of developing cancer. Think about breast cancer, accelerated by alcohol use and tobacco, because people usually drink and smoke together. And they're learning not to do that now. But as I grew up, alcohol and tobacco were intersectional. My father and drank and smoked. So, and it's a part of the lexicon. We talked about this, and black men and the Rat Pack, and those men of the 40s, 50s, and 60s that kind of defined their manhood by alcohol and tobacco. Again, and again, an individual's risk of developing cancer due to alcohol consumption is determined by a complex interaction of biological, environmental, social, and economic factors. I see this largely in women now that can afford to buy the alcohol they choose to drink, because they're able to maintain jobs, they're able to maintain, credit, and so they're able to do those things, as opposed to, African American men that credit's not good. If it's not a good job, then you most likely have to pay out of pocket for alcohol, which means you don't use as less. You use more of a cheaper type of alcohol, the 12-pack of whatever beer is of your choice. I think that that's something we have to center around and kind of understand and start to, because this could be intergenerational. I think that the first thoughts that I saw of alcohol is my uncles and the average gathering where alcohol was available, military alcohol available. So, so that's why moderation has to take place. We have to kind of understand that these chemicals in our body that we're so afraid about putting in our body, you can't pick your chemical to put in yourself, right? Even food. So I think that's one of the things we kind of start to look at and think about and start to put a price on, whether it's good or bad, or whether you can live with it, or, can you be, the teetotaler versus cessation. There has to be a balance in between, because I see too many health concerns. Myself had an issue with pancreatitis because, I was drinking. And it wasn't I was drinking a lot, it's that my body couldn't accept it for the time I had done it. We're talking about over years, and so, you live and learn. And so, in addition, what are they talking about doing? So, an update on Surgeon General's health warning labels, including alcohol-containing beverages, and be included as cancerous. I'd also say sugary sweetened drinks be included too. One of the bigger issues around diabetes now is sugary drinks. So, and I think that it's really important that we kind of embrace that. So, again, calling for more labeling, discussing risk assessment, the medical record systems now, as a part of the social determinants, request that you record alcohol amounts and the amount of alcohol that folks are consuming, so we can get a look on it. And I think that the numbers are kind of skewed, because I think that people drink more than what they say. So, additionally, public health professionals and community groups should highlight alcohol consumption as a leading modifiable cancer risk factor and strengthen and expand education, right? Education in regards to efforts to increase general awareness, and healthcare providers should inform patients in clinical settings about the links that and promote the use of alcohol screening and treatment. I think that's so important that people understand, they understand the risk and the shared decision making. Again, want to give a shout out to Dr. Michael Lenore. And again, he's been very instrumental in the growth, and we are collegial, and he's one of the top Bay Area allergists in the Bay Area. Appreciate him and his family, and welcoming into the practice, and working through this major health care system that we're working with to provide care. So I really appreciate that. And again, just let me co-host with him on a lot of his media issues, and we're looking to a long-term collaboration. So I'm really excited about that. And I think that I would be amiss in this year if not talking about, the legacy, folks like Chuck Johnson, who gave me my first break. Jeff Watson, thank you very much also. Hey, wishing you well and the family well and everything that goes with those kinds of things. And the folks at Comcast 26's public network that I was able to broadcast on, including Berkeley Community Media, where I did a lot of my first tapings and my shows, as well as San Francisco Community Media. So it's been a wealth of exposure, a wealth of transition and understanding this media piece. Because look, if we don't tell our story, someone else will tell it for us. And that's kind of one of the things that Chuck Johnson taught us and taught me. Happy Martin Luther King Day. It's on the 20th, right? January 20th. And such a Herculean person. And till the day he was murdered, advocate for people's rights and community rights and the rights of the workers. That's why, think about it. That's why he was murdered, because he was going to not only advocate civil rights, but he was going to advocate for the worker that he felt was being disrespected. That's why he went to that meeting of the garbage workers, to help advocate for higher wages. He was out of his lane. And he had a really good relationship with Malcolm X. So these are the kind of things that if you don't tell your story, someone will tell it for you. And so a part of the next part of the show we're talking about in this thing we're doing with this month is vaccinations. And the question came up, and I'm going to ask the question again, says, what did your mother or what did your provider not tell you about vaccinations, good or bad? And so got into a spirited discussion with Dr. Lenore, and we also added about mother's home remedies like, mustard plaster and honey and lemon and all the things that didn't cost anything, but man, did they sure work, and just, and I just more think about my mom in terms of being that person that had something that would help you feel better, including her love, which I think was more of the love than the elixir. Again, I want to give a great shout out to all of my Facebook family. And some of you folks are going to come on, so I know that. And we're going to be excited about doing a Zoom piece where, going to bring more folks into the discussion. And I'm excited about that. In fact, talked about it this morning with the lead etymology. So, something a little about vaccinations. Less than 50% of children in the U.S. aged 6 months to 17 years were up to date on their vaccinations against COVID for 2023-24. And you can have your discussions about COVID. You can have your discussions about measles. You can have your discussions about whooping coughs, but I'm 69. I come from a vaccinated issue. The schools provided vaccinations. The public health facilities provided vaccination, and it's my belief that, a lot of children would have died from measles, whooping cough, gotten polio, if not vaccinated. So I believe that you gotta be okay with that. And so the percentage of children receiving COVID vaccinations is higher, but still it only represents half of the children, like 52%. So only half of the children in America are vaccinated for COVID. So we're not even going to talk about whether just the general vaccinations are there or in a place. And what from the literature review, it said it has to do with this thing called vaccine hesitancy. It's a relatively new term used in research over the past few years to describe anyone who's doubtful about vaccinations or who chooses to delay or refuses immunization even when they are rarely available. Vaccinations but we have to understand vaccinations played a vital role in preventing children. That's what we're talking about. Children and disease. We're talking about the community. We're talking about the elderly community. We're talking about the immune compromised community. It's the one that Dr. Slaughter would say, we serve everybody, not just you. Dr. Slaughter, a behemoth in mental health, had the chance to be trained by him and work with him at what was then West Oakland Health Center. And he's one of the first Black men in the medicine that gave me a chance out of school. And it demanded and expected, and an expectation was that I perform on a physician's level. I think we've seen like 20 patients a day in the methadone maintenance clinic. That's where I got my experience in addiction medicine. And felt it should be a part of my repertoire. And Rich Harper knows about that. Thanks, Rich, because he worked with me. So all good. I think he got his master's in or something. So we're gonna maybe we can get him on the show. See what's going on. Thank you very much. And so we have to understand vaccines over historical and evidence-based are critical for children. Critical. So it begs the question, and we beg a lot of questions here. Exploring the reasons behind parental refusal of vaccines. This is by Ms. McKee and Bohannon. Is from the Journal of Pediatric Pharmacology and Therapeutics. So this year, I'll try to be quoting more of my sources and documenting more of my sources because I think it's important that people go and find the literature, review it, or ask the question to see what answers that come up, so we can make intelligent decisions regardless of what those decisions are. So there were 4 categories for vaccine refusal by parents. It's religious reasons, personal belief, philosophical reasons, safety concerns, and desire for more information from healthcare providers, which means we're not doing a good job of educating people, because we should be doing that. It should not be just a given. So I can get it where you got to go see the pediatrician. The pediatrician says per this child's age and sex and development, they need to be these particular vaccinations. And the proof in the pudding is those kids that get those vaccinations, if they even get the illnesses, there are less effect on them if they had a full-blown illness, measles, whooping cough, that kind of thing. So that's what I'm asking people to appreciate and move forward with, and understand that that's how we should be talking about this in terms of people's concerns. It's not unrealistic. But the bottom line is we can prevent death and destruction and morbidity, mortality by advocating for vaccinating for every child that's not allergic to them, of course, or that the substances might cause them harm. And speaking of that, I want to thank Makita. She's the African American woman goddess, hair entrepreneur person that has continued to maintenance my locks and help me, look human. And this hairstyle requires a lot of work. I guess that's why a lot of men don't want to do it. Easy to shave the head. I get it. So again, that's what I want to emphasize, that we can prevent a lot of illness, morbidity, mortality, death, destruction by vaccines. And again, if you can't take it, that's fine, but it should be offered as a part of a a person's standard healthcare armament, you know. And with the globalization of the world, we're seeing a lot more patients that come from other countries where the children have been vaccinated develop these illnesses and get sick from them. So it's something to think about. Concerns for refusal of vaccines or religious reasons are common personal beliefs. Again, issues around safety concerns, desire for additional information are all things that I think are fair game for us. And in terms of fair game, you know, January is also in other words, I'm a believer in vaccines. We should give them, we should understand to have that dialogue about, you know, safety, efficacy, you know, allergy, you know, how these are made. I know that kind of thing. The ultimately long-term issues. One of the things I have to say that there's no evidence between vaccines and autism. I wish we had to stop saying those kinds of things. These are the kind of things that get out when science and education are not honored, and we are more in dogma and loyalty, and you know, saying what people want to hear. So that's the issue on being a clinician in 2025. You can't say things people want to hear. You have to say things that are going to provide them with a roadmap for their care and less impactful care in terms of medicines and therapies, if that's possible. Yeah. In other words, I'm in an arena now where folks' expectations they get medicines. And sometimes medicines aren't appropriate for the particular problem or the level of a medicine given an antibiotic. And the other discussion we're having is the antibiotics now are not as effective as they were 20 years ago. There's more drug resistance toward them. This was why there's a concern, because a majority of the things we're talking about, influenza, COVID, RSV, are viruses. So antibiotics don't work on viruses. They just don't. And so, given that, January is also Mental Health Month. Makes me think about chronic illness and anxiety and depression and the use of SSRIs and the proper assessment of patients in terms of behavioral health models and how these are culturally competent or incompetent. I would like to thank Cheryl Brown, master's nurse that talked about cultural competency as her master's work. I want to thank her for that, because it's always been one of the things I've had discussions about. Again, I think maybe you're probably doing a PhD now. That's kind of person Miss Brown and her daughter Camila. Hey Camila, super. You're doing super stuff too. Good stuff. Not to miss my granddaughter. She's all good. I like her. All my granddaughters, you know, good. Like to see them more, but boy, it's hard. So January is Mental Wellness Month. Ways to prioritize your mental health, right? Put that at the top of your list, along with the resolutions for exercise, stopping drinking, getting better, along with people that you can't stand, bringing more people into the fold, being more honest, being more ethical, being more empathetic as best you can. That's kind of where we're at. So January is Mental Wellness Month. Ways to prioritize your mental health. This is an article reviewed by Miss Melissa Gaussian. She's at LSW recently as December 24. It's a better editorial team. So according to the recent Society Experiencing Mental Health Crisis, the World Health Organization reports that roughly 1 in 4 people globally will be affected by mental illness in 2024. And that was last year. In the United States alone, approximately 46.6 million adults experience mental illness in any given year. And that's really important because, at least in California, they have, or what's developing as a model is a no closed door. So when you walk into a public facility that is getting public dollars or state dollars, that facility will have to not only assess mental health, not only assess medical issues, but mental health issues, and have accessible referrals for both. That's the way it is. You know, it's called patient-centered care. So, and with the 46.6 million adults, that's the ones we identify. I would say to you, it's more like 60 million, or maybe even 70 million. And the other 30 million are in denial. So, and here's something about youth. The National Alliance of Mental Illness, NAMI. Oh, NAMI, right? Okay, NAMI. Ms. Howard, you know, and her work with G.G. Crowder, NAMI. 1 in 6 youths between the ages of 6 and 17 experience a mental health disorder each year. And we're not even, and if we include the transgender gender youth, the non-identifying gender youth, it's higher. And the whole discussion around trying to remove a community from the lens of anything that requires health assessment or education is just inappropriate, and it's not good medicine. It comes back to bite you. In this case, with the LGBT community, a higher rate of suicide in young folks, preventable suicide. I heard it from a young lesbian woman asking, did the present administration believe that she exists? In her transition to he. Yeah. And I think what we have to have is a holistic approach, not just to mental health, but health in general, so that we are not locking people into a silo and treating them like they were like a fast food hamburger. You can't have joy anyway, so you can't have joy anyway, so we have to have the discussion about it, definitely, about having joy, about being happy, about being okay, you know, about the traumas that you have to go through. And, you know, if you don't go through anything, you can't address anything. And what we say about the COVID epidemic, right? Says the COVID-19 pandemic has further exacerbated this crisis in mental health. This is a crisis with marked increased symptoms of anxiety and depression disorders, even more prescribed, not only in all communities, but everyone in general. We're all a little bit amped up. Okay. This is Believe Radio's 24-hour inspirational and gospel music station. I want to thank Almaji Curtis for his steadfast dedication and get me through this process. And we're going to try to be on time. We're going to try to do all the things we've tried to do to make this happen. I want to expand the platform. I want to expand to Zoom. So we're going to be moving to that. And mental health wellness, not sickness, right? Wellness. It provides an opportunity to constantly reflect, reassess, and recalibrate your mental health strategy, because if you don't take care of you, you can't take care of anyone else. One of the biggest discussions that I have with folks about taking care of themselves, whether it be that wife, daughter, mother, friend, partner, whatever the persuasion, it's hard to take care of yourself when you're taking care of everyone else. So work on that a little bit harder this year. That's my prescription. So this time of year is not focused on survival or getting through the winter months, but proactively emphasizing mental health awareness and self-care. In other words, we want to focus more on mental health wellness versus mental health illness, and keep one's healthy as opposed to keeping one sick. And the treatments that they entail. So that means early identification, you know, opening up and talking about issues and concerns, you know, And if people can't handle it, then that's their problem, particularly in the healthcare space. Could be in the mental health phase. We're going to have to do that. We're going to have to do that. And that's to begin with you. Can't care of you, can't take care of nobody. And that's not selfish. That's, marking out and taking time for whatever it is that, settles you. So again, and January is Mental Health Awareness Month, and it authorizes you to take care of your health. So January is recognized as Mental Health Awareness, and this is from one of the AI discussions, a time to dedicate to promoting awareness and understanding of mental health. The basis of this observation is to encourage individuals to reflect on mental health habits, prioritize self-care, and seek professional support when needed. You can't be afraid of going to talk to somebody about the anxiety, about the depression, about the trauma, about the abuse, because that lends itself to how we need to heal them. You won't do it within a box because, woe is the person that makes actions on their own understanding. You need to create a broad stroked approach that allows for stuff like meditation, relaxation, not necessarily medicine tools to address acute anxiety from a step down approach, or identifying the agent of the anxiety and saying, how is this really real, or is it something that I'm thinking about? What I think going to happen, because all the possibilities haven't been played yet. And so the hope is to focus on mental health. People can build a resilience and reduce stress and improve their overall well-being. Now, this month aims to spark conversations about mental health and reduce stigma and empower individuals to take charge of their wellness. And that's one of the things that having that quality of mental health understanding and culturally competent. Thank you very much, Ms. Brown, Mr. Harper, having culturally competent providers that can help you pull back some of those curtains that some other providers can't, not because they can't, because it's painful for them too to pull it back. Trauma is intergenerational, and it's the gift that keeps on giving. In other words, if you weren't traumatized by the past few events of the past month, then you're not really functioning well, because you should be. And then you start to heal. It's not the trauma, it's the healing that takes place. And there's some great tips for doing mindfulness. So some of the things you can practice mindfulness. And exercise like meditation, deep breathing, yoga. If you can do that, that's a tough one. Can reduce stress. For me, it's running, walking. Maybe it's putting on a really nice bit of music. There are a lot of these relaxation tapes on YouTube. Put your headset on and give yourself that quiet time. And really do like some of the stress meditation tapes, to get your day started. Try those kind of things. Try something different. Do something different. Just don't do the same thing. That was insanity, doing the same thing over and over again and expecting a different result. You won't get one. Stay active. My physical activity is not only good for your body, but also for your mind. Aim for at least 30 minutes of exercise a day to boost your mood and energy level. I say every other day is something that you can tolerate. Don't go over your level. If you haven't run in 5 years, don't expect to go do a half marathon. All this is a progression. You see these women working out with weights, but they're progression. They just didn't start doing that. Whatever it is that you need to start, as we start progression, slowly increasing and understanding, it takes time to get where you need to go. Connect with loved ones. Spending time with family and friends and can provide emotional support and reduce feelings. And I know you sometimes get tired of family and friends calling and early morning, but it's just because they love you and they want to find out what's going on. So we have to be okay with, love, and don't take it as a personal um, interruption of your life because you grew up with these people, you broke bread with them, you used the bathroom with them, you fought with them, but they wouldn't let anyone hurt you. So you have to be cognizant of that, and a lot of this is like getting the base because we're going to talk about in the next few minutes about what the answer is if we can't do this, in the way we want to do it, and it's set realistic goals this time and all the time and take breaks, break time for yourself to recharge, whether it's a short walk or reading a book or do something different. All right. And that's kind of that. Now, always with the soft touch is the hammer approach. And so Governor Newsom signed legislation to strengthen mental health and substance use disorder care for all Californians. And I want to thank Terry West for checking us out, and Mr. Harper, and all you folks. Thank you. Nicole, thank you. Wow, y'all just coming out. Thank you. Appreciate you. So what you need to know about this law, if you live in California, and this was, I guess, 2024, Governor Newsom signed a package of legislation to strengthen and streamline access to critical behavioral health care services, including the first in the nation care court. I know you've heard a lot about it. You should read about it because it could affect you and your family, or could be beneficial to you and your family. It says, and here's some of the discussions: tackling the mental health and substance use disorder crisis facing our nation and state is one of the most important goals of his administration. We say Gavin Newsom. Stuff like Gavin Newsom, he ain't been perfect, but he's been pretty fair and balanced as best he could, given the fact that he's a white male that's had this deal in a white world. And if he ever thought about doing more things, then the discussion gets you a Trump elected. So anyway, or unelected. So, and I know you guys have been hearing about this care course, so I'm kind of trying to break it down. Since we are actively urging people to get life-saving treatment and supportive housing through innovative solutions like care court and conservatorship reform, and working to ensure that these initiatives respond to the feedback we've been hearing. So here's a discussion. A person can have a mental health challenge and refuse care in California. He could go and if and this I'm talking about a 20-year period that person did not have to get care, and that was a majority of homeless folks on street. Not all of them, because this is a new level of homeless now. The homeless now is family from lack of income, from lack of accessible issues. And so we're having now a discussion about, homelessness and housing and low income housing as opposed to affordable housing. Because in this area, affordable housing could mean that you will make $100,000 a year. My family's, they're seeing max maybe $80,000 for a family of four. Anyway. So, and I want you to understand that now there won't be a choice to have care if you are a person that goes through the care court system, or family pushed you through the care court system, or the criminal justice system. Because the other opposing piece of that was incarceration, where I saw 25% of the population that was incarcerated had mental health challenges, and I was asking why were they here instead of treatment? Because they were refusing treatment, and they had done whatever they'd done so much they had to be incarcerated. And when they got incarcerated and they got treatment, they did much better. So this is just not someone deciding to take people's rights away. I think that's kind of the important take-home message about this. So some of the bills where it says it streamlines county and court implementation of the Community Assisted Recovery and Empowerment Care Act, clarifying types of communication between petitioners, respondents, judges, and the county behavioral health department to destroy it means to ensure participation along with stabilization subscript. So patients could refuse care, and there was no endpoint toward one, how they would go through the system and how they would, in order to be released from the system, maybe in long-term in hospital institutions or secondary psychiatric settings until it was a plan for them to be treated and for them to, one, engage in that treatment so they can move on. So that was the issue. And if you decide to break that process, then you just didn't participate in it. You fully could do that. Now that's not the case now. And I think it has to be something that, whether I agree with or not, we have to have a solution to this. Because what happens is this community ends up suicidal, ends up addicted, ends up homeless chronically, ends up multiple medical problems untreated. And for a long time, I can think of a good friend of mine in particular who was, he cost the Alameda County medical system about $1.2 million. That's how many times he went to the ER before he died of hypertension, diabetes, infection, homelessness. So SB 1238 by Senator Susan Tamale expands the types of facilities where people who are held on a temporary conservatorship for substance use disorder may receive treatment, to also include mental health rehabilitation centers and psychiatric facilities, because these facilities couldn't welcome folks in. And now, as cost was prohibitive, the families could not afford to have them go because it costs too much money. That's no longer going to be the case. If you're mandated by the care code to go, you will always go to a facility that will see you and treat you. That had not happened. Again, mental health is a primary driver of mental health illness, of medical illness. They're one and the same, because if you have mental health challenges and you have voices and psychosis, you're less likely to take the pill because you think the pill's poison. It's your blood pressure pill, your diabetic pill, or treatment. So that's what this discussion is about. And so, and the issue around substance abuse is the endpoint. The real issue is treating the mental health issue, the anxiety, depression, the major depressive disorder, the schizophrenia, the bipolar disorder. You manage those issues and clear the voices and clear the behaviors, and people can get things done. So I think that that's really, really, really helpful. And I want to thank all the folks for their comments. I will try to provide this information. I think that as the bigger picture goes out, you can go get snippets, but you have to have a foundational base for how we're thinking about this and how we should be thinking about this. Whether it's from vaccines, which you talked about, the alcohol use, which you talked about, to mental health challenges that we're talking about, to the CARE Act in California, which some would think is draconian, but we have to try something different because what we've been doing has not been working. Because if you can refuse care, then you can't even start. You can have the best care, but if you don't get it administered, So, for example, long-term, for young men would do better on long-term injectable antipsychotics if they have schizophrenia or bipolar, because they don't have to think about taking the pill. This is the kind of mandates that if you just get the person and medicine in the person becomes more functional. So there's going to be families and institutions and religious orders that, have to be okay with people getting treatment and getting help and advocating for that. That's my biggest issue. So SB 1400 by Senator Harry Stearns out of Calabasas increase transparency and accountability for counties and courts in implementing the CARE Act by requiring additional annual reporting of the state. It requires a court in a misdemeanor incompetent to stand trial hearing to first determine if this person can be provided mental health challenge issues. So that's what you want. You want a right to present your case, even as a person that's sick. And if you can't defend yourself because of mental incompetency, then you need to get treatment. It's just that simple. If your blood pressure was high, I'd give you medicines for blood pressure and try to control those risk factors around you, i.e., total lifestyle changes. But I need to control that blood pressure so you don't have a heart attack or stroke until we get those other things in place. Stabilization. Same model. And one, you want to prevent a heart attack and stroke, and one, you want to prevent a psychiatric meltdown that encompasses at least 25 people from the time that person has a psychiatric episode, barring that he's able to avoid police shooting him or her. Yeah, that's what we're talking about here. So CARE Court. CARE Court is a first in the nation approach to create accountability for connecting individuals with untreated psychosis to treatment and housing that they need. That they need. Not that they want it, that they need it. So when you pass by in Oakland in particular, Berkeley in particular, numbers of folks on the marina, wherever, that are camped out. I'm not talking about the ones that are RV. I'm just talking about camped out. And then certainly you have to be able to understand what is driving that so that you can treat it and advocate it for. So hopefully the discussion would be healthcare teams that go out and they're doing that to have a discussion before they move people. Because I brought this up because the inadvertent moving of these people says where do they go and what's going to be their mandate for care. And we as a society, particularly in California, since we passed this, has to be guardians of this so that people aren't abused and that their rights are provided with. And again, they have to be competent. So this is under CARE Court. Families, first responders, and healthcare providers and others are able to take action and file a petition with their local care court to help people with untreated schizophrenia spectrum or psychotic disorders get treatment and housing. As of August, care courts in the 9 counties were helping at least 700 folks get treatment and housing, often in response to petitions filed by a family member. All 58 counties would be on board with the care course by December 1st, 2024. We're in 2025 now. This is fully implemented now. And if it had not been, you would have been seeing it go to the Supreme Court, and the Supreme Court probably would have kicked it back to the state. This is the kind of Supreme Court we have now anyway. This is a mandate from the people. The people have spoken. Okay? Whether you agree with it or not, that's the discussion. And we'll see as this model progresses whether it's going to be the best thing happens, sliced bread, or the worst thing happens, a crisis in care. I want to thank you folks for tuning in. This is my first show of 2025. I want to thank all the responsible and great folks and just the whole expansion of love and all that good stuff. I always say that you can't progress in something unless you've had to deal with something. And so we can't look at our challenges as challenges. We look at it as opportunities to change and grow and be the best people that we can be. That's the attitude that I'm taking as I move forward, and I'm excited about the host of opportunity and the ability for me to change and learn and be what I be. I'm wearing my dad's coat because I want to give a montage to him and my stepdad. They were really classy dressers, James Pearson and Jimmy Lee Smith. Love both those men, and I'll give out to my family and my son, who has his challenges, was working on those things, and all my granddaughters. And you may see my mid granddaughter pop up on my timeline. She's just she's a heart to me. That being said, we have about 5 more minutes. And again, the issue in the discussion says California is transforming the entire behavioral health care system. They result more and better mental health substance use care for all Californians. In March 2024, voters passed Proposition 1, which includes 2 parts, a $6.4 billion behavioral health infrastructure bond to build capacity settings and housing for services, because that's what the issue. You could have a mental health challenges and not where anyone to see the person. You have 51 person stuck because there weren't enough beds at John George, and again, overwhelmed and understaffed. And they've talked about the settings and housing with services and historic reform of the Behavioral Health Systems Act to focus on people with the most serious illness, substance disorder, and supportive housing needs. Prop 1 is being implemented across the state at a record speed. And what I say to that is that when you do this, that person still doesn't understand that they're no longer homeless. And I'll talk about it in discussions, but bringing folks from a homeless situation to a living situation is a shock for that person because they're so afraid of being moved out. They can carry their basket with everything piled up, and because they've been told to move so much, that's what's locked into their brains, even though they have a apartment with a key, with garbage pickup and, all that stuff. That's the re-education that we have to do and help folks kind of, be case managed into the new life that they have. It's almost like that commercial where you become the homeowner your father and your mother was, and it's hard breaking those habits. I think it's progressive. I'm not going to quote that, but it's always this older white guy that comes up and helps these young homeowners who are becoming their parents. I think I am. I think I've become my parents. Again, I want to thank you for listening, tuning in. It's always great when I get a chance to share these things in the big picture so people can look at the big picture, because the big picture will affect your travels. So you can advocate for your family members that, man, if you don't get treated, there's a law in California will make you get treated. So all that stuff, case management, moving the person toward, normalcy as best we can. And again, I want to thank everyone. I want to thank for tuning in, and we talked about a few things, a number of subjects, alcohol use, mental health, mental wellness, vaccinations, and the California Care Act. I want to thank all you for tuning in and watching. Again, I want to thank Curtis and Etymology for their input and helping the show create, a bit of format. I'm trying to get here, be better on time, ready to go at 2:00. Been a little bit remiss in that, so we're gonna start the New Year's resolution, right? Got that one. And again, I want to thank you guys for listening in. We have so much to do, so much to learn, so much to grow from. Hope everyone had great holidays and just rounding out Thanksgiving and Christmas and New Year, and I wish everyone the best, and to take care of themselves. In January, wellness for your health. The things like relaxation and meditation and eating properly, eating a balanced diet, so important. Plant-based. Reduce the meat intake. Get the activity. Hug on your loved ones, wish them the best. You may not always get along with them, but that's it. And, I want to give a special shout out to my sisters and Eddie, my sister, friends, husband, Eddie Bridges, and my niece. Again, she's a newly minted MP, and she's working out in Sacramento. I think she's in a nephrology practice too. So, congrats to her, and want to thank Recovery uh, for all the folks that are doing that are taking care of themselves. Um, Big Veronica, hey, get well soon. Keep taking care of yourself. Books in the mail. Forgot about that. So, want to thank all you. Hey, Dr. Green, Rosalind, great RN, Nita, out of adult medicine in Fairfield. Hey, presence in the mail. I got that. Don't worry, I got you. So I want to thank you all for just tuning in and being the people that you are, and all the comments and all the interaction. Love it. And as we get soon going to be moving folks to the website and all the things that are going to be there available, just to kind of, keep the knowledge going and deal with fact and not with fiction. Again, thank you.